When I say the words mental health, what are some of the first things that come to mind?
Misery, shame, pulling away from loved ones and even from yourself.
Mental health is something that's just as important as physical health to you, because your brain is in charge of everything, and if your mental health is lacking, then everything else is going to be lacking too.
Definitely making sure that my well-being is taken care of. To me, mental health is definitely just as important as physical health, and I don't feel like it's talked about enough.
How many people do you think suffer from mental health issues in America?
You know, I think that most of us do. Most of us have something underlying, whether it's been diagnosed or not.
Probably 75% of people.
Way too many. Way too many. I couldn't even think of a number for it.
A great deal.
Could you list some mental health issues?
Depression, schizophrenia.
Depression, anxiety, bipolar disease, paranoid schizophrenic.
Anxiety, depression, bipolar disorder, schizophrenia, schizoaffective.
Anxiety, PTSD, depression, bipolar disorder, schizophrenia. Pretty familiar with a lot of them.
Do you think mental health conditions are increasing or decreasing, and why do you have that answer?
I think mental health conditions are increasing simply because we have social media nowadays, so you can look around and see how everyone else is happy because it's just a snapshot of their life, and you start to internalize that, wondering, why am I not that happy? And that can really take a toll on your mental health, and I don't see social media going anywhere anytime soon.
They're increasing. I know that some of this is passed on from one generation to another, and they try to self-medicate, beginning with substances. Generations past, it was alcohol. More recent than that, it has been marijuana and LSD, and now it's meth and opioids. It's progressing and getting even more damaging, harder to truly heal from.
I believe increasing. I think that social media has a huge impact on it. I believe that that's where a lot of the bullying starts, and people become, depressed in their self-awareness, thinking that they're fat or not pretty, or that people don't like them. I think it makes it easier for people to kind of hide behind technology and to go out there and to tell people what it is that they think about them, and not being able to realize who it is that they are.
I think it's increasing. I just think we keep moving forward in a world where it's go, 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 and it's all about the money and the time and everything, and we're not really taking that time to take care of ourselves anymore. It's become very corporate, and I think that we have a lot more stress, and the technology doesn't help us either.
I think that they're probably increasing for a multitude of reasons. One, doctors are learning more about it. There's more research on it every day, so something that may not have been diagnosed in the past is now being diagnosed as a mental health issue. And I also think that things like social media are not only causing it, but helping bring an awareness to it. There may be some people who didn't realize that they had a mental health issue until they read about it on the internet or something. And I think social media could impact your mental health if you're comparing yourself to other people, your successes or your failures. And I think that it can give you more anxiety. You realize what's going on in the world more than in previous years when there wasn't constant news coverage.
If a close friend or family member announced to you that they are struggling with a mental health disorder, what would you say to them, or what would you like to say to them?
I think it always starts with empathy. You always have to be, just be there, be able to talk about it. But I mean, it's important to know that you're not alone, and that there are resources out there and people there to help you and get you through it, whatever that looks like for you.
I'd like to tell them that no matter how bad it gets, or how low they feel, or how little control they feel they have, I'll always be there for them.
I would want them to know that I'm here for them, and I am always there to listen. But if they think that it's something that is going to impact their daily life, they need to find some kind of help, whether it be seeing a counselor or just going to a doctor and talking it out and trying to figure out what the best options are so they can get better. Because I don't think that everybody should have to suffer from it. There's a lot of options.
that we can conquer this disease just like we are conquering others, HIV and AIDS and cancer and diabetes. And they should not have to live their lives in the shadows, but be able to come out and eventually become well and contributing parts of society and happy in their own skin.